This article about Meghan Trainor's surrogacy is being framed as feminist critique, but it's actually quite misinformed. Here's where the article is misleading, inaccurate, and ideologically driven. The rich people renting the wombs of the poor framing is a caricature. This framing erases who gestational carriers actually are in regulated systems, conflates ethical domestic surrogacy with exploitative international practices, assumes poverty, coercion, and lack of agency as defaults. Whereas in the US and similarly regulated context, most gestational carriers are financially stable, often middle class, many are married, insured, and have children of their own, and many report positive experiences and repeat their roles as gestational carriers by choice. The article also deliberately ignores infertility and medical reality. The piece never seriously engages with why people use gestational carriers. Uterine factor infertility, including being born without a uterus or having a uterus removed for medical reasons, recurrent pregnancy loss, medical conditions where pregnancy is dangerous or impossible, cancer survivorship, same-sex male couples. Instead, it reduces all intended parents to buyers and all gestational carriers to discarded bodies. The maternal bonding argument is also weak. Claims like skin-to-skin contact, a poor simulacrum of true maternal bonding, are emotionally loaded, but not evidence-based. What we actually know is that newborn attachment is shaped by consistent caregiving, not gestation alone. Adopted infants, NICU babies, and babies born via gestational carriers form secure attachments. The baby M case is misused. Invoking baby M in the 1980s in an unregulated traditional surrogacy, no IVF, no modern safeguards, is like using bloodletting to argue against modern surgery. Modern gestational surrogacy uses IVF, does not involve the gestational carrier's genetic material, includes extensive psychological screening, and includes independent legal counsel for both the intended parents and the gestational carriers. And then the line, whether the surrogate feels harmed is not the point, is revealing. Dismissing someone's own reported experience because they don't fit a theory is not feminist, it's paternalistic. So what would an honest critique of surrogacy look like? Surrogacy can be ethical only when it is fully voluntary, heavily regulated, medically and psychologically supported, and legally protective of surrogate autonomy. None of that is controversial among responsible fertility professionals. In fact, it's why many countries, including the United States, emphasize regulated, consent-based gestational carrier models. What this article does is use a celebrity as a proxy, collapse all surrogacy into its worst examples, shame parents publicly, reduce women to symbols instead of people. That's not protecting vulnerable women. That's performative moral outrage. The bottom line, you can oppose exploitative surrogacy without denying infertility, erasing surrogate agency, misrepresenting science. This article isn't really about ethics. It's about moral purity, control of women's reproductive choices, and discomfort with non-traditional families, dressed up as concern. And intended parents, gestational carriers, and clinicians all deserve better than that.